Hi everyone. In today's clip, I will talk a little bit about non-steroidal anti-inflammatory drugs or NSAIDs. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So, NSAIDs are a class of medication used to help with pain and inflammation, some of which available without prescription and over the counter, such as acetyl salicylic acid or ASA, which we have under the names, let's say, aspirin, entrophin, Novacin. We also have ibuprofen like Motorin or Advil, and naproxen like Aleve. And the list of NSAIDs is actually long, with more than 20 currently available over the counter. And they do not contain steroids, hence the name non-steroidal. We also have custom designed NSAIDs called Coxib, like Celebrex, to minimize the risk of stomach ulcers. So Health Canada and FDA have reviewed all of the available studies on NSAIDs and Coxibs. Both groups have found that NSAIDs and Coxibs are associated with an increased risk of cardiovascular disease issues like angina, heart attacks, and strokes. The risk is greatest in those patients who use these medications for a long period of time and have risk factors for or history of, let's say, cardiovascular disease. So Health Canada recommendation has a series of recommendations, which are: 1, do not use NSAIDs or Coxibs directly before, during, or after heart surgery, such as like bypass surgery. Patients with history of cardiovascular disease, such as angina or heart attack or TIA or stroke or congestive heart failure, should be careful when they're using NSAIDs or Coxibs. Patients with risk factors for cardiovascular disease, basically those with, let's say, diabetes, they're smoking, elevated cholesterol, or obesity, should also be careful using these medications, and safer alternative treatments should be used if available. NSAIDs and Coxibs should be used in the lowest effective dose for the shortest possible duration of time. So now, those are all the recommendations. So NSAIDs work by blocking prostaglandins. Prostaglandins are hormone-like substances made by nearly every cell in the body in response to injury or infection. And they sensitize the nerve endings and enhance the pain during inflammation. So prostaglandins also play a role in controlling the body's temperature. And by inhibiting the effects of prostaglandins, NSAIDs relieve pain and bring down fever. Now, just to sidestep a bit, prostaglandins manage inflammation and pain, have a hand in blood flow, stomach protection, and reproductive system. So whatever plays with prostaglandins will also play with many areas of our system. If you have been taking, or if you are taking any other medication, definitely check the drug interaction and discuss with your healthcare provider before using these medications. Just because they are available over the counter, it doesn't mean that they are actually safe for everyone. Rat poison is available on the over the counter, actually. So one main thing to remember at all times is that your body is never lacking medications. It is lacking nutrition. We provide nutrition to the body, and not just by eating. We also have spiritual, emotional, and physical nutrition. So physical nutrition includes what you inhale, what you eat, what you put on your skin, and the chemicals and the hormones that you produce through your emotions and thoughts and so on. So our body works from inside out, not the other way around. Healthy mind, healthy body. The medications we ingest end up going through the whole body and through various vital organs, and at times disrupting their proper function. When there is pain, that is where your body is sort of communicating to you and that there is something wrong, something is not going right. So imagine the house is basically on fire and the alarm is going, and we take the alarm and toss it out because we don't want to hear it. So how will that serve us? And sometimes not only we toss the alarm out, but we go out partying, which is when we take medication to forget about the pain, and then we go out partying, shopping, whatever. At any given time, if a medication is required, rest and nutrition is also required. Medication is not the cure, nutrition is the cure. So if you've been using Nsaids for a long time and now you're trying to cleanse, you need to know that they impact several organs, most commonly stomach, kidneys, and heart. They can also affect the liver, respiratory tract, and in general, the whole endocrine system, and sometimes even the brain. To naturally support the body to recover from the long-term use, we need to start by restoring gut health, also liver function, and restoring or sort of relieving inflammation. I would suggest first doing a comprehensive blood test to better understand what area of the body is most under stress at this point. Then consult your healthcare provider who will monitor and provide guidance throughout your healing process, especially if you are on other medications. Remember, there is no one-size-fits-all when it comes to healing. So next, address gut health, first through use of pre and probiotics. It needs to be like 50 or more billion CFUs with multiple strains, preferably sort of like 11 strains or more. And fermented foods like kefir, sauerkrauts, kimchi, and so on, as well as L-glutamine, which would need to be 5 grams of powder in water on empty stomach on a daily basis, which is an amino acid that helps repair the gut lining. Next would be a liver detox, and for this we will need cruciferous vegetables like broccoli, Brussels sprouts, kale, cauliflower, kelp, and as well as milk thistle. And milk thistle would be like at least 300 milligrams standardized extract a day, and turmeric with black pepper, which would be around 1,000 milligram a day. And of course, staying hydrated is important. So the next level would be reducing the systemic inflammation by using omega-3 fatty acids, around 2,000 milligram EPA DHA, turmeric and ginger, green tea, and limiting the salt and sugar intake and avoiding processed foods, of course. Whole berry diet for a couple of weeks will improve the liver, kidneys, and endocrine system health in general and resets the organs back to what they're supposed to be. To support the stomach lining, we will need, for example, aloe vera juice, somewhere around 2 ounces, 20 minutes before meal. We need DGL licorice root, chewable, before dinner, and 1 cup of bone broth on a daily basis. And in general, gentle exercise, proper sleep, avoiding alcohol are the key. Now, taking magnesium glycinate, somewhere around 200 to 400 milligram just before bedtime, also helps you to relax and heal the tissues and supports the detox. Always check any interactions between herbs, vitamins, and any other medications that you might be on. Hope this has been helpful. Like and follow for more. Be the light.